بفضل الانتفاضة التونسية.
Jam 12 baru dibantu.
Hi everyone, good evening everyone. Welcome to SWACA's webinar on vaccination for refugees. This is our 9th webinar series in which we talk about human rights and also about regulation and also law in Indonesia regarding to refugee rights. So my name is Julio Castor Achmadi. I'm the coordinator of legal empowerment in SWACA Indonesia, and we are very glad to have you all here. Just for your information, we are conducting this in 2 platforms. The first one is on the Zoom, and then the second one is on LBH Jakarta's YouTube channel. So if you have friends who want to join this meeting but unable to because we're nearly full, the Zoom can only manage about 100 participants. So please redirect them towards LBH Jakarta YouTube channel. So again, thank you very much for allocating your time and spending it to discuss with us here regarding the access on vaccination for refugees. As all of you have already known that Indonesia and even the world is facing a new challenge in which it is the COVID-19 pandemic. And within this pandemic spread, even Indonesia and the Southeast Asia region, Indonesia is one of the top contributor to the positive cases. And we can also say that refugee population as the marginalized community in Indonesia is not the priority of the government within the vaccination program. Yeah. However, we have also seen that there are several good practices in access for vaccination for refugees in Indonesia. So today we are conducting a very, very interesting discussion in which we are trying to let everyone know whether they are refugees who are staying in Indonesia or those who are concerned about refugee issues in Indonesia. So at the moment we have here a representative from UNHCR Indonesia, Mas Hendrik Terik. Thank you, Mas Hendrik Terik, for supporting SWACA again in our webinar. Mas Hendrik is the Protection Associate, community-based Protection Associate in UNHCR Indonesia, and he will become our speaker for the day. So if you have anything that you want to ask, Mas Hendrik is the person that you can direct your questions to today. So everyone, just a quick disclaimer for this meeting and this discussion. It will be aired, so it is live on Zoom and also live on LBH Jakarta YouTube channel. So please take into consideration on using your video. Your video will appear in our live stream, so please be careful if you do not want your face to be shown in the live stream. And then the second one, all of this discussion will be documented by SWACA Indonesia, not for other commercial purposes, just for our internal documentation only. And then if you have any questions during the presentation and the discussion, please text them on the chat box. We will not be opening a direct question and answer session for the effectiveness of this discussion. So please type all of your questions on the chat box. We will take the relevant questions regarding vaccination, and I will ask them to Mas Hendrik. And then finally, please make sure that your speaker is on mute, so it will not disrupt the flow of the discussion. And without any further ado, because we want to discuss a lot regarding this vaccination access for refugees in Indonesia, I will give the floor to Mas Hendrik. Mas Hendrik, the time is yours. Thank you.
Thank you very much, Mas Julio, and greetings to all participants who have joined in this webinar series. And first of all, I guess introduction from my part. My name is Hendrik Terik. I work with UNHCR Indonesia in Jakarta from the community-based protection unit, and it's good to be here again with Swaka and everyone in the legal webinar series. And today we have been asked to share on information on COVID-19 vaccination for refugees. So I've prepared some slides to show you, and then at the end, if there's any further questions, of course, I'm happy to respond as much as I'm familiar with the question. So let me start sharing the screen, and Mas Julio, can you confirm if the screen has been shared now?
Yes, I can see your screen.
Okay, thank you very much. So yes, as mentioned by Mas Julio in the beginning, COVID-19 pandemic, has greatly affected, all states, including Indonesia. And until now, as you all have experienced, that we are in a situation where the government has implemented what is called restriction of public activity level 4, where a number of restrictions is being placed on public activity due to the increase of COVID-19, especially on the Delta variant, which is highly infectious. And when it comes to the COVID-19 vaccination, in this session, I will share about some of the good practices that has taken place in Indonesia when it comes to COVID-19 vaccination for refugees. Some information on the challenges, barriers, the policies when it comes to COVID-19 vaccination in general and how that relates to refugees, and more information on how refugees, are able to access COVID-19 vaccination. Yeah. So when it comes to COVID-19 and vaccination, of course, it's UNHCR's view that an inclusive approach should be taken by all states to include all marginalized group also, because to form a herd immunity, it's critical to include all aspects of the community, and one of them, of course, is refugees. We have almost 14,000 refugees registered in UNHCR in Indonesia, and those eligible for COVID-19 vaccination, meaning those 12 years old and above, there are around 10,000 people. Now, globally, UNHCR has monitored that from 162 countries that we have monitored to have presence of refugees. 123 now have included vaccination plans for vaccination of refugees in the national plan. And until 5th of July, we have noted that 94 countries have actually started vaccination for refugees. So UNHCR's focus is to advocate for inclusion of refugees in the government's national response plan. And we also call to the states to remove any barriers that limit access to vaccines. And UNHCR, of course, working closely with the different partners, are ready to assist the government to ensure the refugees within the area is able to access COVID-19 vaccination. Talking about Indonesia, currently these are the list of vaccines that has been approved or authorized by the government. And They are, of course, Sinovac, then AstraZeneca. Then we also have the Sinopharm. Then we also have Moderna. And lastly, we have Pfizer-BioNTech vaccine. So these are the 5 vaccines that have received the emergency use authorization from the Indonesian government. And also, they have also received the emergency use listing from WHO, the World Health Organization. Currently, just to note that the Pfizer-BioNTech vaccine, although has been approved, it has not arrived yet in Indonesia. According to the government, the vaccine will arrive sometime in August. So the recent arrival of vaccine is Moderna. And in fact, this morning or this afternoon, Indonesia received the 30th shipment of vaccine. So vaccine has been arriving quite regularly now. And according to the government report, there are already 70 million doses of vaccines that is already arrived in country and distributed. Now, when we talk about COVID-19 vaccination management in Indonesia, the purchase of it or receiving via donation, that's all handled by the government. The government also prioritizes who is able to receive the vaccination. As you may know, the government has set the first priority was given to the healthcare workers, and then follow up with frontline workers, people with comorbidities, then follow up with the elderlies, then follow up with all the general population, and then now they have also included the children aged 12 years old and above. The distribution also is managed by the government. So the cycle of the purchase, the prioritization, the distribution is all managed by the government. And the regulation from the government is COVID-19 vaccine is free for Indonesian nationals. Now, of course, private sectors, they can pay to have the vaccines to be used by their staff or workers, but the staff or workers themselves are not supposed to pay for the vaccine itself. Currently, there is no procedure for individuals to go out there and buy vaccine. If you may have read the news a few weeks back, that the government was planning to have what they call gotong royong individu. This is a private sector scheme where the government will allow individuals to buy vaccines from the Kimia pharmacy. However, after receiving feedback from the different people, then the government has canceled that plan. So at this stage, even if you have money and you want to buy the vaccine legally, there's no procedure yet being established by the government for individuals to buy vaccine. When it comes to the scheme of vaccination in Indonesia, there are 2 schemes. Of course, the first one is the government vaccination vaccine. So this is done through the government's national budget. And of course, the second one is the one that I just mentioned before, is the private sector scheme, which is called gotong royong vaccination. So different organizations, they register through the Chamber of Commerce their interest to pay for vaccines of their staff and workers. Then the government will go out and purchase the vaccine. So it's not being purchased by the private sector themselves. So as mentioned on the top, all the purchase or even donations. Now donations, you may have seen some reports, especially during the recent wave in Indonesia. There were some donation of vaccines. Australia donated some vaccine from AstraZeneca. The US government donated Moderna vaccine also. And this vaccine has arrived in Indonesia. And to manage the vaccine rollout in Indonesia, the government has created this system, which they call a PCARE, Vaccine Information System. This is where all the vaccine recipients are registered. And you will see how this system, while good for tracking people who will receive vaccination, can be a barrier to access to vaccination for wider population, be it Indonesian nationals or even foreign nationals. So first, to answer the question, can refugee access vaccination, COVID-19 vaccination in Indonesia? I mean, the short answer is yes. And we'll give some good practices implemented by the government. In June, in East Aceh, there was arrival of a number of Rohingya refugees by boat. And after the arrival, then the local government in East Aceh was able to administer COVID-19 vaccine to the refugees 18 years old and above. It was done in the island where they arrived. However, since they have arrived, they haven't received the second dose of the vaccine yet. Why they haven't received? Because after they arrived in East Aceh, they were then moved to Medan. And until now in Medan, there has been no possibility at this stage for refugees to access COVID-19 vaccination. So those who received the COVID-19 vaccine in East Aceh in June 2021, they're still waiting for the COVID-19 vaccine, the second dose. And the first one that they received was from Sinovac. Another good practice is in Pekanbaru. So you may have seen, you may have heard from your colleagues or read in the news. In June, the government, the local government, especially in Pekanbaru, they were able to give COVID-19 vaccination, once again, Sinovac, to refugees there, 18 years old and above. And early July, they were able to give the second vaccination. So they are fully vaccinated. So this is good news. However, there are still some challenges, which I will share later on related to this. And another good practice is the vaccination that took place in Kupang. Kupang is in the eastern part of Indonesia, it's part of East Nusa Tenggara province. Again, in June, the local government was able to provide vaccination to refugees there. And then in July again, in fact, just last week, they were able to get their second dose. Once again, this is for the 18-year-old plus, and it's a COVID-19 Sinovac vaccine. So these are some of the good practice where the local government, in collaboration with the different concerned partners, there's IOM, UNHCR, and other local partners, they were able to facilitate vaccination for refugees. However, as I mentioned, there are still many barriers and challenges, not only in those areas that have received COVID-19 vaccination, but also to other areas where at the moment there has been no official process or progress on COVID-19 vaccination for refugees. And many of these are due to the regulation. As mentioned, the management of the COVID-19 vaccination is with the government. So far, a number of local government has been able to successfully administer COVID-19 vaccination. However, there are some other local governments who are waiting for further guidance from the national government. So this is what has been done also at the national level, meaning in Jakarta level, by UNHCR, by IOM, and by other concerned partners, including JRS, WACA, CWS. Everyone has interest in ensuring refugees have COVID-19 vaccination. So IOM and UNHCR, we have sent a joint letter to the Ministry of Health. Now we express our appreciation on the support that has been given by the government to refugees related to COVID-19 services. Refugees are able to access hospitals, even quarantine facilities if they are affected with COVID-19. So we express our appreciation to the government on that. Furthermore, in the same letter, we request the government to consider inclusion of refugees in COVID-19 vaccination program of the government. Then we receive a letter, well, not directly to UNHCR or to IOM, However, the government, through the Ministry of Health, then wrote a letter to the UN Resident Coordinator. Now, who is the UN Resident Coordinator? UN Resident Coordinator is the head of UN in Indonesia. And basically what the letter indicated is that, yes, the government confirmed that refugees will be included in COVID-19 vaccination. However, from the government's point of view, the priority is still for Indonesian nationals whose estimated completion of vaccination will be in 2022. So obviously, we appreciate the confirmation from the government, and then the UN Resident Coordinator then wrote a letter to the Ministry of Health appreciating the confirmation, but also request an accelerated timeline. As mentioned in the beginning, refugees are living within the community also, and to achieve herd immunity, everyone, ideally would have to be vaccinated. So not only Indonesian nationals, but also marginalized group, in this case, including refugees. So we have sent, the UN Resident Coordinator has sent a response to the government. And this happens in parallel with the different discussion that takes place at the national level and also at the local government level, because at the national level, we discuss with the ministry level, we also discussed with the local government level at the different areas to see how COVID-19 vaccination can be accessed by refugees, at an accelerated timeline. One of the examples also, we sent a letter also to the governor of Jakarta, requesting the inclusion of COVID-19 vaccination for refugees, not only in Jakarta, but in the surrounding area. So this is what we have done to request for this advocacy. And recently we received another letter. As you may know, the management of refugee in Indonesia is led by this particular unit. It's the National Refugee Task Force, which sits under the coordinating ministry for law, security, and politics, law, and security. And the letter that we have received, UNHCR and IOM has understood, is that the government reaffirmed the confirmation of refugee inclusion in the COVID-19 vaccination program. However, the letter also indicates that the Ministry of Health should make the SOP, and what is the procedure, what is the technical guidance for refugees to access vaccination. This will help also answer a different question that has been raised by different local governments on guidance from the national government on this. So this is from the part of the regulation side of things. You may recall I mentioned just a few slides back on the vaccination information system and the registration. In Indonesia, there is this system that has been developed by the government. They call it the PCARE system. This is developed by the Social Security Agency, which is called BPJS. However, until now, recipients of COVID-19 vaccination requires an Indonesian ID number, which is obviously not available for refugees at this stage. In this system, UNHCR ID number cannot be used. Now, we are hoping to have a further discussion with the government in discussing this procedure on how refugees can be properly registered. And you may recall I mentioned also in the beginning, having this online registration system can also pose barriers to other Indonesian community to access vaccination. We've seen some challenges also for unregistered Indonesian nationals. There are some Indonesian nationals maybe living in remote areas, border areas. They may not be able to receive vaccination because they do not have the Indonesian ID number. So there are still a number of challenges related to having an online system as a tool to manage COVID-19 vaccination. Now we understand the importance of the tool, which is to prevent duplication and all that. However, there are still some barriers, some challenges. Therefore, in some places, manual registration was done. Now you've seen UNHCR has shown the positive, or at least the good practice in Aceh, in the Pekanbaru, and in Kupang. In those areas, refugees then were registered, but it's more manual registration. So at the end of the after the vaccination, the refugees will get some sort of paper, which is called like a vaccination card or a statement, but not the formal certificate. I will show you the COVID-19's official certificate later on, which is issued by the government. This is normally issued if the individual is registered officially in this PCARE system. Now, UNHCR documents actually can be used now if it is allowed by the government. You, as refugees, you may be familiar with these documents. Currently, UNHCR has two types of documents. One is the card type, a small card type, and the other one is the blue A4 size paper, which we call under consideration letter. And if you see your documents, under the photos, there is something that is called a UNHCR individual number. You may be familiar with what is called the UNHCR case number, which is something usually towards the top, either in the card or in the certificate, the UNHCR case number. But also in the UNHCR document, there is something that is called a UNHCR individual number. Now, this number is unique. No single refugee will have the same number. And this, is, in principle, is similar to the national ID number for Indonesian nationals. So when discussing with the government, we encourage also that to have an individualized record of refugees who have access to COVID-19 vaccine. The individual number can be used. So UNHCR documents is actually ready to support the government if the government, or no, when the government has started to prepare the regulation, the SOP, the procedures. Let's see. Yeah, that's unique to all persons. And this is the proof of vaccination. Every time a person in Indonesia gets vaccinated, the person, depending on the location and who is giving the vaccination, will receive either of these. It could be a small card, which is called the COVID-19 vaccine card. It's a small card, like a bit larger than the bank card. It contains the info, your details, and also contains the schedule, the first schedule, and then what is the second schedule for COVID-19 vaccination. And in some places, you will get an A4 printed paper explaining basically the same thing. And in some areas that refugees are already vaccinated, different kind of documents are issued at this stage. Recalling again, the automated data is based on that PCARE system, so sometimes that's not possible. But I've seen a number of refugees who has benefited from COVID-19 vaccination. They have received also the smaller card. Now, once you've completed the 2 doses of vaccination, or even now, if you've completed the vaccination, if you are registered in the system, you will get this one here, the one on the right. Now, this is the official certificate of COVID-19 vaccination that is issued by the government. This is the color for the first dose. It tells the name of the person, the ID, and the date of birth. There will be details on what kind of vaccine you receive and the date of that you receive the vaccine. The second dose will be similar in layout, just different colors. So this is what normally is received. And currently at this stage, this exact document is not yet received by refugees in those examples that I've mentioned in the beginning. So this is part of the advocacy that we are making with the government to make sure that refugees, at least one, have access to COVID-19 vaccination, of two, and two, of course, have some sort of proof that they can keep and show as necessary that COVID-19 vaccination has been received. So how can a refugee access COVID-19 vaccination in Indonesia? And to be completely honest, at the moment, there's no simple answer yet. I've shown you the good practices from the different areas, and that takes a lot of advocacy, different discussion for the government, the local government, to allow access to COVID-19 vaccination. There is, at the moment, no established procedure yet for refugees to go somewhere, ask to get the COVID-19 vaccination, and then get it easily. There has been refugees who have done their ad hoc, they've done the arrangement on their own and successful, but it's still a very small number. But there's no formal procedure yet that we know of that refugees can just go and access vaccination similar to Indonesian nationals. And how it's done for Indonesian national is, for example, if I'm in Jakarta, the government has established a specific website called Jaki. In this website, we go in, we register our name, and we get what we call a vaccine ticket. And with this vaccine ticket, we register and we can choose the place where we get vaccinated and the time and everything like that. Since refugees at the moment are not in that main government system, e-ticket for that vaccine system is not possible at this stage. So another just background information also, the vaccine rate in Indonesia generally is still low. I mean, this is the graph as of 25th July. And I've highlighted Indonesia here. Indonesia now, as of 26 July, is actually now around 21% of the target, which is 208 million refugees, individuals in Indonesia have been vaccinated. So Indonesia is still quite a long way. We're still below the world average, and certainly below the average of some other countries. This information, if you're interested, you're welcome to go into the website of the One World in Data, and then they will have this information that you can have a look. Indonesia at this stage, as of 26th of July, have vaccinated around 60 million or so refugees. 21% or 45 million has received the first dose, and 18 million has received the second dose, or 8%. And when we count refugees that has received these complete 2 doses, the numbers would be around 5 to 6%. So the number is still relatively small. And when we talk about refugees who have received the first dose, is around 6%. And this is more on efforts done in the local government level, and some what we call ad hoc arrangement. Things or arrangement organized by the refugee themselves in contact with the local authority or with the community that they're involved in. So if you ask, at the moment, today, how can refugee get COVID-19 vaccination? I would say, let's wait for further updates from UNHCR, as there's no established mechanism. This is something that we have been working hard to get from the government. As mentioned in the beginning, all the vaccine allocation is managed by the government. It's not a matter of money. That even if we have the money, still the procedures, the process, how it goes, is still being managed by the government. And this is something that we are pushing to get. And there is some positive development. This morning, actually, we received a letter from the National Refugee Task Force that tomorrow we'll have a meeting. There will be a National Refugee Task Force, the Ministry of Health, IOM, and UNHCR we'll be discussing about this, COVID-19 vaccination for refugees. So hopefully through this meeting, then we will have a better understanding on how the government wants us to proceed when it comes to COVID-19 vaccination for refugees. Because, as has been done in the different areas, UNHCR and IOM and different partners, we are ready to help the government to ensure that refugees have access to COVID-19 vaccinations. I mentioned before, there has been some ad hoc arrangement. There are some refugees living in South Jakarta. They were able to consult with their local RT and then able to get registered. This is something that we know has happened, but this is something that may not happen in all other areas because it depends on your relationship with the local RT, what's their view on COVID vaccination, and then in most cases, the local puskesmas, local community health center or the local vaccine center, they are waiting for guidance from Jakarta or from the national government. Now, we have heard also reports of some refugees. They have been able to receive vaccination through the community that they are involved in or they're part of. We've heard about a number of refugees who are attending university or schools. They were able to get COVID-19 vaccination facilitated by the schools, and some maybe attending some other religious organization or becomes friends, partners with some organizations, and they were willing to support. So we've definitely heard about this, ad hoc arrangement, meaning arrangement by the refugee themselves with the different communities that they're on, and they have been successful. However, as I mentioned before, there hasn't been any established procedure yet, which is something that we are working on, and it's not only done by UNHCR, it's done also by IOM and by our different partners, including JRS, CRS, WACA, because everyone, and I understand in the call, there are also different expatriate community who are also concerned and willing to support. And everyone is trying their best with their own way to advocate with the government for better inclusion. We know refugee is included, but we want the process to be better, to have a clear process after the vaccination, get, proper documents about this. And once we have, more information, of course, UNHCR and partner, prior to the vaccination process, we'll have an information session, as we know that not all refugees perhaps may understand about, what is this COVID-19 vaccination, what's the benefit, what's the risk if you don't have this COVID-19 vaccination. We've been working with our partner to prepare an information session to give awareness to the wider refugee community on COVID-19 vaccination and the benefits, and hopefully by that time we will have information on the procedures. At the moment, we are not able to tell you the procedures because it's still being developed by the government yet. So, hopefully, in the coming days and weeks, we will have more clarity from the government on what is the standard operating procedure, what is the technical guidance to have vaccination for refugees. Then from that, once we have that, I think we can pick up the pace and then start to discuss with the government to what we call is implement the last mile. The procedure is good, but then at the end, how to get the vaccination from the policy side and then into action and directly into the hands of all the refugee community. And vaccine is safe. Vaccine is halal. We have received the guidance. There's guidance already from the religious authorities on this. Some Indonesian has been able to receive COVID vaccination, including myself. We have been able to receive COVID-19 vaccination. Fortunately, there's no side effect, but it is something that important for us to know beforehand what is vaccination, what is the potential side effect, and all these different questions that you may have. And I'm sure we'll be preparing all this information and having sessions to better inform you on COVID-19 vaccination once all the detailed arrangement has been finalized with the government. I think that should be it from my side. Thank you very much for your attention, and I look forward to answering some of the questions that you may have related to the COVID-19 vaccinations. Back to Mas Julio.
Thank you very much, Mas Hendrik. It was a very, very great information that you shared with us today. And I believe that we have a lot of questions, whether they are from refugees, whether they are from Indonesian nationals, or just people who are concerned about refugees in general. But before we go to the questions, I would like to remind everyone here that we're not going to take a direct question. So please put your question inside of the chat box. And if it's relevant to the vaccination issues that we are currently discussing, then I will be asking that question towards Mas Hendrik. Mas Hendrik, I've seen a lot of questions from the chat box and from the YouTube channel. But before we go that one by one, I would like to just confirm with you first about several things. So the first one is that the vaccination is managed by the government of Indonesia. So all of the vaccines are being managed by the government. There is no way for anyone to manage the vaccine besides getting them from the government. Is that correct?
That is correct. That is due to our best understanding. All the COVID vaccine management is by the government. Of course, the implementation will depend on the different partners. For example, to give an example from UNHCR side, UNHCR, we have our vaccine conducted through the private sector scheme, and the one who implement the vaccination itself is the Bunda Hospital. So Bunda Hospital will make all the necessary arrangement, including registration of all the personnel who will be vaccinated, and then we will have to verify our data. So at the moment, there is not a possibility yet that individuals can actually manage vaccination. There are already assigned different groups who can administer. So the management side is one thing. Who can administer? There are different system and schemes. People may have heard police and the military. They are also administering the vaccination, but that's based on the quota or the vaccine that is provided by the government to them. And they can work with different organizations such as Muhammadiyah, such as Nahdlatul Ulama, to actually implement the actual vaccination. But the top level management, who gets the vaccine, how much is distributed to each particular area, that's from the central government and then in coordination with the local government.
Okay, noted about that. So the whole managing thing is being governed by the central government, but they can work together with the local government, and then in conducting the administering of the vaccine, they can work with other partners. So there are several schemes to do that. Okay, thank you.
Yeah, correct. That's why there was some success in Aceh, Pekanbaru, and in Kupang, because it's managed by the central government to send the vaccines to the different areas. In the different areas, then the local government, they have the authority also to manage, how it's actually being done, or what we call the last mile, the last kilometer, you can say. Technically, how it's administered, where and who can get it, and that's also being done by the local government. Unfortunately, for some local governments, they do not take the liberty of making the decision themselves, so they would seek guidance from Jakarta. That's why for other areas, big areas where there are refugees like Tanjung Pinang, Medan, Makassar, Semarang, even Jakarta and surrounding area, at the moment there is still no procedure yet for this. They are still seeking guidance from the central government.
Okay, thank you for the confirmation, Mas Hendrik. My second one would be, so you as an individual, anyone as an individual cannot get the vaccine even though they have money by themselves, so they cannot buy the vaccine. Is that correct?
Correct. At the moment, legally, yeah, we're talking here about legally obtaining vaccine. The audience may recall that a couple of weeks back, the government did plan to have what they call gotong royong individual vaccine, or individual gotong royong. Basically, what this means is individuals can actually go to a Kimia Pharma. Kimia Pharma, you may have seen, they're quite literally everywhere. It's a government managed, government-owned private sector. They were supposed to be able to administer vaccine purchased individually by the any individual. Unfortunately, due to different reasons, feedback from the community and experts, the president has decided to cancel this. So at this stage, there is no set procedure for individuals who may have the money, wants to buy the vaccine for themselves and get administered. The only way is, at the moment, even as Indonesian national, if I have the money and I'm not vaccinated, there's no way for me to buy, because the only mechanism is has to go through a private company, if I'm part of this private company, who will then make the request through the government to obtain the quota of vaccine.
Okay, so even though you can afford to buy it, but you can't, because there's no legal way for you to buy those vaccine individually.
Correct. That's what that's the current situation in Indonesia, which may be different than other countries. And we can understand this procedure, because in general, as mentioned, vaccine is still very limited, not only for Indonesia but globally.
Okay, thank you so much, Mas Hendrik. We will be starting to answer several questions. I will ask you one by one so you can answer them directly, please. So we have here from Ibrahim. Is vaccine compulsory or optional?
Thank you. That's a very good question. It should be known that vaccine is not compulsory. So it's not mandatory, it's optional. Now, having said that, increasingly more, we've seen not only in Indonesia, but governments may choose to implement regulations where people who have not been vaccinated, and there's no clear reasons why they are not vaccinated, they may not access certain activities or services. Just to give an example, in Indonesia, at this stage, if you have not received at least first round of vaccine, you cannot travel by plane outside from Jakarta to any other area, because one of the requirements for you to travel by plane is to show a proof of first vaccination. Now, we don't know yet what the government may implement in the future, but certainly from the point of view of recipients, including for Indonesian national, COVID-19 is not mandatory. You may have reasons, many people may have very good reasons for not being vaccinated. They may have some prior history of medical illness, comorbidities that it's not compatible for being vaccinated. Pregnant women at the moment. Also, there may be some other legitimate reasons, and normally this is proven by a doctor's letter. So if you have also a doctor's letter that recommends you that you cannot be vaccinated, that's also good. But even without that, the vaccine is not forced, so it's not compulsory, so it's not mandatory. However, we're just noting that observing different government procedures in different countries, there may be certain services or activities that may be affected if you don't have the COVID-19 vaccination. So yeah, the short answer is no, it's not mandatory, but we'll have to see down the line and see what the government's policy related to access to services for those who may have not been vaccinated. Thank you.
Okay, thank you so much, Mas Hendrik. So it's not mandatory, but there might be some restrictions that can be imposed to you by the government if you are not vaccinated.
Yes, we'll have to see. There's not much information on this, but that's something for us to be aware of in the future.
Okay. Okay, the next question, Mas Hendrik. We received a lot of questions related to vaccination and prior medical situation from an individual, like you've mentioned before. But just a disclaimer for everyone here, Mas Hendrik is not a medical practitioner, so maybe this question cannot be answered completely, and you have to still look for further information. But I think because it's still relevant, maybe Mas Hendrik has some information about it. I will still ask it to Mas Hendrik. So Mas Hendrik, there are questions. Can an individual receive different types of vaccines for their first dose and then the second dose? And how about those individuals who cannot get vaccinated because they have comorbidity or other illnesses that prevent them in getting vaccine? So how would that result for refugee in Indonesia?
Thank you. I think this is not specific to refugees, yeah. When it comes to the comorbidities, mixing vaccines. First of all, we are not at the liberty to choose which vaccine we get. That's there just to make it clear. Since there's no system where we go and buy. We don't have the system like in Singapore or in Australia where individuals can actually go and choose, which vaccine. We will get what vaccine is available in that location and based on the availability. You can on the day you can choose that I don't want this vaccine, but at this stage you cannot go to a particular place and then be offered, there is AstraZeneca or there's this. So there's no option at this stage for that. When it comes to mixing vaccine, I will refer, of course, once we have further detail on the awareness session for vaccine, because I don't want to give incorrect information. However, there are just to make sure everyone knows that this vaccine goes through all the different research. And what I've read so far is that there has not been enough evidence to say that mixing vaccine is authorized. There hasn't been just not enough authorization. We will see if that is possible, because different country will issue a different authorization on the possibility of mixed vaccine. Now, having said that, in Indonesia, you may have read the news. For especially healthcare workers, they have received the first and second dose with Sinovac, and recently the government has started administering Moderna vaccine. So, looking at the possible example, the simple answer is it is possible, but it's not something for us to individually choose. The government has gone through the different process and the different authorization on what kind of vaccine can be administered to different group of people. So I don't want to answer in detail, as mentioned, I'm not a medical expert, but certainly there has been example of vaccine mixing in Indonesia. Example is the vaccine for the healthcare workers. However, will that be available for the general population? There's no information yet. And similar question related to this is booster shots. Now it's considered as the third booster shot. At the moment, as mentioned, I have received the Sinopharm vaccine twice. And at the moment, there's no guidance from the government whether or not I will be receiving a third booster shot. So we are working especially on vaccine based on the guidance from the government, especially on the guidance from the Indonesia's version of the FDA, the Food and Drug Administration Authority, which is in Indonesia called Badan POM or BPOM. So there hasn't been any further advice on that. On comorbidities, illness, what I can say is before all vaccine event, there is a screening from doctor. So you cannot just go to a vaccine place and then go straight to get the injection. You will pass through a different check. There is if it's online, there will be like an online questionnaire screening that you need to answer. After that, you will sit down, actually, once the registration is confirmed, you will sit down with a doctor who will take the necessary temperature, the blood pressure, and ask you a series of questions. And then from that, the doctor will make the recommendation whether or not you can get the vaccine. So if you have comorbidities, don't worry. There is no, at the place of vaccination, there will be doctors who will be checking on this. And when it comes to the to the refugee. Of course, we have not detailed the design of how it may work for refugees, but of course, as per experience from other areas, there will be also interpreters on standby to help interpret between the doctors, the medical staff, the registration staff, and the refugee themselves. So you may check with the authorities. If you live under IOM support, you may check with the IOM counterparts. They have all your records. They may be able to give some initial advice on the possibility of you obtaining vaccine. If you are living independently, that means you may consult with the CWS health hotline just to inquire. But for now, since there's no procedure yet, now we cannot tell you exactly, but that's what when I mentioned is there are set steps for a person to be vaccinated, and no one will be vaccinated before going through a health screening process. Hopefully that answers.
Mm-hmm. Okay, thanks a lot, Mas Hendrik. So I'm also compiling a question related to vaccination and resettlement. So we have questions. So let's say a refugee got a certain brand of vaccine that doesn't allow them to travel to the USA or to the Europe because it's not accepted there. Yep. So how do the vaccination process affects the resettlement process of a refugee from Indonesia?
Thank you. That's a very good question. I will park this also to consult with my colleague in UNHCR about the resettlement. Mm-hmm. However, what we can tell is yes, resettlement country, like any other country, they may have this requirement of vaccination, and this will be organized and discussed between UNHCR and also IOM. As we all know, when it comes to the departure of the refugees on different programs, either on resettlement or on private sponsorship, is supported by IOM also. And there are a set of documentary requirements, and this will be ensured that if you are supposed to travel, then any necessary documents will be processed to ensure that you are able to leave the country on the different schemes that you're on, but still meeting whatever requirement of that country is. So whether you leave on resettlement or private sponsorship, or even you go back to your own country on voluntary return, the regulation of the respective country will be respected, and then and that's why we are hoping we can certainly get the formal procedure from the government on the refugee vaccination, because it only has an effect on travel externally, from Indonesia to other country, but also affects their travel internally. For example, in Aceh, we do have some refugees who may have to be transferred to a different location, and at this stage, vaccination is required, and we're trying to get that happen. Or refugees from one area may need to come to Jakarta, for different reasons, and that also at this stage requires COVID-19 proof. So all these efforts will be made if travel is necessary and needed. So consult with the local IOM or UNHCR focal point, on the relevant issue, and they will be able to update you on what is being done related to this. Because obviously, we will not let you go if all the documentary requirement is not completed at this stage. Thank you.
Okay, thanks a lot, Mas Hendrik. So we have a very interesting question. It's from Rangi here. They have two questions. The first one is that related to the vaccine in three cities of Indonesia, Aceh, Pekanbaru, and Kupang. Is this regulation purely the local government regulation, based on the local government regulation, or is it from an order or recommendation made by the central government? So that is the first question. And then the second one is also the thing that I would like to ask. If when the system or the mechanism of vaccination for refugees is established, how will UNHCR make sure that every refugees will be able to access it? And how will you prioritize those refugees? Because we have several layers of vulnerabilities, and how will UNHCR decide that?
Thank you very much. That's a very good question. Let me start with the first question on the vaccination in the 3 areas. Vaccination in the 3 areas is done, yes, by the local government, and it was the policy of the local government itself. So the local government, obviously the local government consists of different units, yeah? When we talk about local government, most likely there will be a mayor or what is called a bupati. Basically, they're the head of what we call second level administrative government. Also, the one who administered the COVID-19 vaccine could either be the local health office or other health authorities that is authorized to give COVID-19 vaccination. Now, besides local health office or what we call Dinas Kesehatan, who else? There is also a unit from the Ministry of Health, which is called the Port Health Authority. So at the airports, at the seaports, there are also the health authority. They also have the authority to give vaccination. So vaccination can be done by any of these government units that has received COVID-19 vaccination from the central government. Now, does the central government know? Ideally, as part of the system in Indonesia, the central government also would be familiar with this. I cannot speak individually to the different areas. However, that's what the experience is in different areas. As I mentioned, the approach is also different. In Kupang and also in Pekanbaru, I understand there are individual vaccine documents that is being received by the refugees after they receive vaccination. In Aceh, it's a different system. The local government writes a statement letter, and then the letter lists all the names of the individuals that were vaccinated, and that is used as some sort of proof that the refugees in that particular area has received COVID-19 vaccination. So that's why from UNHCR point of view also, it's important to get also some sort of overarching umbrella policy from the national government, because at the moment there are good actions from the local government, but also we hope that there can be a centralized procedure which will help then the local government make the decision. You may recall there has been discussion at the levels in Tanjung Pinang, in Batam, in Makassar and Medan, and the local government there is saying that they actually need guidance from the central government. So some have taken the opportunity, with their own discretion, perhaps also through consultation with the national government, but some are waiting for actual guidance from the government. On the what's the second one, Mas? About the second question?
The second one was about if one day the mechanism of vaccination for refugees has been established, how will UNHCR make sure that every refugee in Indonesia can access that? And how do you prioritize those who are more vulnerable?
Yep. So as number one is ensuring all refugees get vaccinated. There are 2 aspects to this. Number one, let's talk about those who are living in partner accommodation, including IOM. Obviously, IOM will be familiar with all the different people that they are involved in, and they know the criteria from the government of those who are eligible to receive vaccination, and the important data can be there. From UNHCR side also, speaking mostly about those who live independently. Now, when I mentioned there's 2 parts of this. Number one, of course, refugee. It's important for refugee to continually update the phone number, the location to UNHCR through the specific form that UNHCR has to update the address and phone number. But number 2 also, UNHCR, as some of you may have experienced during the COVID pandemic, has been providing what we call the COVID-19 relief. And during this process, we actually contacted, all who are we able to contact and verify the phone numbers and address of different individuals. So we do have the list of those who are recorded in our database. There are still a few who we are not able to trace. However, that's something that now we'll work on. The number is not that many, but through the existing information, through the COVID relief verification system, we have information about most those independent living refugees. And IOM, of course, they have the system. So that's why we are able to identify at this stage around 10,000 refugees are eligible for COVID-19 vaccination in Indonesia, age 12 years old and above. Now, of course, there are people with the comorbidities, the people with different health background. They may not be able to. Now, UNHCR does not necessarily have all the records. However, I'm sure IOM, through their health program, and CWS for independent living, they have their own records, and they can inform the refugees if there is any potential challenges for the refugee to access for COVID-19 vaccination. However, as I mentioned, in the vaccination effort before the actual vaccination activity, there is actually a screening. So you can self-screen yourself by consulting, for example, the CWS health hotline, or asking the IOM focal points. Or you can also, during the actual vaccination time, you can consult with the doctor, say that I have this situation, am I allowed to get vaccination or not? So that's basically what I can say about those, especially with the conditions. We can be proactive to check with CWS, just to check if I'm with this condition, whether I'm eligible for the COVID-19 vaccine. CWS may be able to answer, or maybe they would have to refer to the doctor, because again, it's best to have the doctor who gives this medical advice on whether or not you are able to access the COVID-19 vaccine. Thank you.
Okay, Mas Hendrik, thank you. Thank you very much for your explanation. So Mas Hendrik, we still have several questions and several times left. So we will be answering to the best extent that we can, but because we have a lot of questions, maybe we have to fill that. So we have here a statement from Amelia Lemondi, an Australian expert here, and has been very closely watching the situation about vaccination of refugees. And Amelia said that there is an opportunity to collaborate with Ombudsman of Republic of Indonesia, ORI, who are very interested in the issue. And then also Amelia suggested that in the revision of the regulations, or inside of the provisions, for example, the Keputusan Menteri Kesehatan, to state that refugees are eligible to access vaccines. So Amelia states that it is very important to have it in written form, so we can ensure that the vaccination for refugees are being written inside of the regulation.
Yes,
I think it's a possibility to collaborate with ORI as well, if it's of their interest and of their attention.
Yes, thank you very much for the question, and thank you to Amelia for the for the support that you have been giving to the community, and not only, of course, we recognize a number of different expatriates who have been already in contact also with UNHCR when it comes to advocacy on access to COVID-19 vaccination for refugees. And that's the whole point that we are trying to get with the government, is to have the actual procedures. And that is actually also what is being requested by a number of local government, to get some written confirmation that yes, COVID-19 vaccination will be available for refugees. Because once again, there are two different streams. There are different schemes of COVID-19 vaccination. One is organized by the government, one is organized through this gotong royong scheme. Now, if it's organized by the government, definitely there needs to be some clarity, some clear information, so refugees can go to the different vaccination centers and then not get pushed back and denied the COVID-19 vaccination. Now, we don't know yet whether the scheme will go through that government program. However, most likely from the initial discussion, the scheme may go through the gotong royong or the private sector scheme. And that's something that we are thinking may happen. Now, we don't know yet. Now, let's wait until the discussion tomorrow to understand. However, the experience in the other areas, it was done by government. So in Aceh, Pekanbaru, and Kupang, it was done by the government, and refugees were either one, directed to go to a specific space where then it's specifically organized for refugee, or number two, the government actually comes. So the vaccination team actually comes to the refugee accommodation to get the vaccine. Now, this will pose some challenge for refugees who live independently. However, there are a number of schemes, at least suggestions that we have offered to the government also. For example, we know that in Jakarta and surrounding areas, if we talk about Jakarta, Jabodetabek, Jakarta, Bogor, there are a number of refugee centers, either the one organized by UNHCR, partners, or even the refugee established learning centers. They can be utilized as centers, if the different refugee centers agree so. But we'll just have to see on what the government's procedure is, because most likely, if it's done by the gotong royong scheme, it's normally organized at some specific vaccination center where only those who are registered will go there. So then we will be able to tell exactly to the refugees, go to this particular place on certain date, certain time. So pending all this detailed discussion, I think it's well noted the suggestion. We are also hoping for some sort of confirmation. We leave it to the government on what's the legal framework for this confirmation. It could be through the KMK, which is the Keputusan Menteri Kesehatan, or in English it's Ministry of Health decree. It could be in the form of a circular note. Now we will see. We don't want to dictate what kind of regulation the government has to issue, but certainly from UNHCR and partner side, we want clarity, especially for refugees. And to ensure this fact that a number of refugees have tried to go to different vaccination centers and was turned back because they didn't have their national ID number. So yes, that's something that we're hoping, I don't know if tomorrow's meeting can go into those particular details, but at least that meeting tomorrow hopefully is a start to then, the further discussion on developing the procedures, which hopefully includes this, messaging on the refugees, having access to COVID-19 vaccination. Thank you.
Thank you, Mas Hendrik. Continuing to the next question, this is from Sakina Ali. I think this is a very important one that should be cleared out. Can I still get COVID after the vaccine?
Very good question. And again, a disclaimer that I'm not a doctor. However, information is publicly available. Yep. You are welcome to have a look. The analog that has been shared by some people is having vaccinated is like riding in a car, putting on your seatbelt. We hope that you don't get into an accident, but if you get into an accident, it will still hurt. But at least you don't die. You don't have serious side effect. And that's the same thing for COVID-19 vaccination. At this stage, there has been no claim made that COVID-19 vaccination will prevent you from getting it. In fact, there has been different reports that you can access through the positive sources, that it is still possible for persons who have been vaccinated to receive COVID-19 vaccination. The question people may ask, and so what's the point? The point is, if you receive COVID-19 vaccination, we should focus on what is called, will you get serious? Do you have to be hospitalized? Will you die from getting from COVID-19? And different results of around the world has shown that people who have received COVID-19 vaccination, if in the future they contract again COVID-19, the risk of serious health, serious symptoms or being hospitalized and death has dramatically reduced. So you may still feel symptoms, and some people may not get symptoms, but at least the risk of being seriously ill, hospitalized, or even death is greatly reduced. That's why it's still recommended for people to get the COVID-19 vaccine. And also, after the COVID-19 vaccine has been achieved, it's not really a time for us to open up and then not use masks. The advice from the government until now is still to practice the 5M, wearing a mask, social distancing, and all those good practices still there, because after having vaccine, you may still have a chance to get COVID-19 again, and you may not know, and you may be able to spread to other people. So until the time where the country has reached herd immunity, which is still quite a long way, recall that I mentioned at this stage, the number of people who have received COVID-19 vaccination in Indonesia is 45 million for the first dose, and around 20 million for the second dose. Perhaps around 60 million, which is still far from the target, which is 208 million. So Indonesia is only 21%. So we have not reached herd immunity. So we cannot implement the same policy as has been done in other countries. The bed occupancy rate is still high, but research has shown, at least in the States, that there is more people who are getting COVID-19 now who have not been vaccinated. People who have received COVID-19 vaccine may still get, but at least they're not occupying the spaces in the hospital, preventing those severely ill from getting the proper service. Hopefully that answers the question. Thank you.
Okay, thank you, Mas Hendrik. So we'll be answering several last questions. We have here from Remol, Yayasan Gutanyo. So Remol has two questions. The first one is the developed vaccinated scheme covered unregistered refugees? That is the first question. And then the second one, what kind of vaccine that refugee will have? I think this can be further shaped into, has UNHCR determined what type of vaccine would be more in accordance to the situation of the refugees in Indonesia, be it health-wise or any other consideration beside it? So those are the two questions.
Thank you from Remol for the question. From UNHCR point of view, of course, when we talk about refugees are those who are registered with UNHCR. Are there anyone who has not registered with UNHCR? Perhaps there are some people who may have recently arrived and has not registered. So then we encourage those who are seeking asylum to register with UNHCR. If we talk about refugees, literally translated from the Indonesian context, pengungsi, that could mean IDPs, and there are internally displaced persons. There are possibility for some internally displaced persons who may have not received COVID-19 vaccine, because again they are part of those group who are marginalized, victims of disasters, internally displaced persons. They may. However, UNHCR's efforts is more related to refugees who are already registered with UNHCR, refugees, asylum seekers. So when we talk about refugees, of course, refugees and asylum seekers. So that's the general scheme. For those who are stateless, we encourage the government also to also consider this marginalized group, because the government right now they are also considering all the different vulnerable population, which also includes stateless, refugees, IDPs, people in border areas who access may be limited. So for those group of people, of course, we encourage the government to look also, because they are also part of the vulnerable group who has a part to contribute to the herd immunity in the country. So that's what I can respond to the question number one. On the type of vaccine that refugee will have, at this stage, as mentioned, we don't know yet. In Indonesia, the government scheme S2, it's a government scheme, the gotong royong scheme. There are certain vaccines that's only available through the government, so the gotong royong scheme, such as Sinopharm. Pending discussion with the government, we are not able to tell which scheme that the refugee will be in. However, once we have more information, of course, then we will be sharing with the wider refugee community what type of vaccine they will be expected to get. And also, the second point is at the vaccination center before the vaccine, as I personally have gone through the process, the doctor who will administer the vaccine will also inform you about the type of vaccine, the expired date, and how much the dose you will actually get. So at this stage, we don't know yet on the type of vaccine, which brand, and certainly there are different concerns when it comes to the different types of vaccines. Some are perhaps more difficult for people of certain age group. We advise people to also, have a look. There has been some discussion about the AstraZeneca vaccine and which age group level. This information will be shared once we have also more information on the scheme, the type of vaccine, what are the known side effects from different vaccines. As from UNHCR and our partners' point of view, we will when the time comes, we would like to share as much information as we can to the wider refugee community, so you can make the informed decision on participating and getting the COVID-19 vaccine. Hopefully that answers the question. Thank you.
Okay, thanks a lot, Mas Hendrik. So we've reached at the end of our discussion. We still have several questions left, but we also are not able to answer all the questions because we have limited time. Mas Hendrik, just one last question I would like to ask you. You say that the system is not being established yet. So how can a refugee in Indonesia contribute into developing that system? What can they do while waiting for the system?
Yes, for now, to help the overall system is to make sure that if IOM, UNHCR have your latest contact details and your latest address. I think this is easier for those who are currently living in accommodation managed by IOM or those managed by CWS, managed by different partners, for example, by Yayasan Buddha Suci or from Yayasan Ayo Sophia, and those that we are already familiar with. JRS also, they have certain group of people, that they serve, they have the information. But what we encourage is to make sure that refugees, to ensure update the contact details. We will share the information through the different community and through the partners, such similar to what we have done so far. Once there is information, we will share one with the refugee representatives, through the community interpreters, through the different organizations, the normal organization that we have worked with, the different partners that we are involved with, to make sure that any information reach the target audience. If the information is specific to those under IOM, of course, then IOM will be sharing those specific information. But if it's information for the wider refugee community, especially including those living independently, we don't have specific accommodation, so we will share through all the different partners and refugee contact persons who will be able to share this information to the wider refugee community. So yes, that's one way for refugees to take part. One other way is there are a wealth of information out there. Some of them really bad, some of them hoax. If you see something, don't immediately trust. Read and verify. If you're not sure, ask another colleague and ask a person whom you may trust. There are specific organization partners. If you have questions, you may be able to ask for confirmation. UNHCR, as time goes, as I said, we'll prepare the awareness session. Any materials that you read, we encourage you to read materials from trusted sources. In Indonesia, of course, if you read Bahasa Indonesia, of course, then you can go to the main task force, COVID task force website, the Ministry of Health, the website. There is WHO Indonesia. They have the information in Indonesian and also in English, and sometimes also in different languages also. And UNHCR, from time to time, we will also share information either by ourselves, CWS, or perhaps IOM colleagues. Through their regular program, we will share different information. And I think if there are information that you think, you would like to know more, I think you are welcome to suggest to share with us. I believe our colleagues from SWACA has shared some online form, evaluation form, perhaps also if there are certain questions that you would like to see addressed in future webinars, future sessions, you can make a mention there that we would like to know more about certain aspect. Then we can see how to properly design, because at the end of the day, information session is targeted to give you the best available information from what we call authoritative source that we can trust, and then we'll see how it goes. UNHCR, we don't make prioritize, we don't select the different groups. We follow the procedures within the country. If the country indicates that the priority is given to frontline workers, we try to identify those within the community who work in the capacity similar like a frontline worker. For example, we do have focal points, we do have community interpreters, we have refugee representatives who, in their role, may be going out to the community. They may be considered as a priority. And we actually made a list of priority persons that we have shared with the government. People with comorbidities, we have the information from the IOM colleagues, from CWS, on people who are having certain medical condition who may need to be prioritized. And we've shared the information about it to the government, the numbers. We don't share individual details about your medical records. We share, this is how many we have identified as priority. Then in further discussion with government, hopefully we can proceed further. Since Indonesia has gone through the phase 1, which is for the health workers, has gone through the phase 2, which is for the frontline elderly and people with comorbidities, now entering the phase 3, which is basically for everyone, including children 12 to 17. Now we are hoping in further discussion with the government, we'll get clarity on, one, what's the process, what's the scheme, and once we know that, then we can work with the government to design, because most likely it's not going to be UNHCR specifically organizing the different desks, because there is already a set procedure from the government, the different desks, the different screening, what has to be done, what has to be prepared. UNHCR and IOM's role would probably be there to verify that the person coming, Mr. X, Mrs. X, is indeed the person and the person is eligible. But all the technicalities about the vaccination, that will be done by the government and the relevant authorities that has been appointed to take forward this COVID-19 vaccination. So we are positive that with the recent development, and we hope that this discussion goes forward. And as mentioned, refugees have a role to educate themselves, understand what the benefits of the vaccination, make sure UNHCR and IOM is familiar with where you are. And you may move for different reasons, but make sure we are updated. We are familiar with most of you who live independently, as we do have the COVID-19 verification exercise. So for those who live independently, most of you we have. And speaking of that, maybe I can take this opportunity to inform and especially the independent living refugees that due to the COVID-19 vaccine restrictions, we had planned to distribute the second batch of the COVID relief within July. However, due to all these movement restrictions, the activity has been pushed back to the early August. So let's hope that the restrictions is relaxed, and then early August we can start with this COVID relief for those colleagues who live independently. I think that's perhaps what I can share at this stage, and unless there's any further question.
Okay, Mas Hendrik, thank you so much for explaining all of those things to us. And I'm sure that I myself have received a lot of very insightful information. And I think we can definitely advocate the vaccination access for refugees into a better situation than it is at the moment. And we're looking forward for updates and also how UNHCR and also IOM in Indonesia to advocating the rights of the refugees towards the vaccination. And we definitely will support you. So, Mas Hendrik, just 2 minutes for closing statements, if you have any, please.
Okay. First of all, of course, I know we like to thank the enormous interest in this webinar. I mean, we like to thank SWACA and all the different partners who organized this, and also those who are attending, the refugees, the different expatriate community, some Indonesian nationals, UNHCR partner colleagues who are attending. I think it shows that there is a lot of interest in ensuring refugee having access to COVID-19 vaccination, and that's the whole advocacy, the response from UNHCR, with the support of all the different partners in Indonesia. UNHCR calls for the government to ensure refugees are included in the national COVID-19 vaccination plan, and also as much as possible remove all the barriers that prevent refugees to receive the COVID-19 vaccination. We look forward to the discussion with the government. UNHCR is ready to support the government in the rollout for the COVID-19 vaccination to the refugees. There has been positive examples in several different areas, and we look forward to this discussion with the government to then be fruitful with resulting in guidance, instructions, and advocacy to the local government, and to ensure that COVID-19 vaccination will be available to the refugee population in their area. However, let's wait for this process from the government itself. We are ready with all the information, the refugee data, even the ID numbers. We are ready to share with the government to ensure that the refugees are properly registered. It's good to have the refugee properly registered, but the most important is to have refugee vaccinated. The key for us is to have refugee vaccinated. We encourage refugees to also do their own self-research. If there's information that you may require, send through the feedback mechanism, through UNHCR or through SWACA. We are constantly in contact with the different partners, SWACA, JRS. We will be able to better develop awareness session in the future when we hear also what are the information needs from the community. We encourage refugees who are able to, when the time comes, to get vaccinated. The vaccine definitely helps you from having severe consequences. If you are not able for different reasons, please make sure you get doctor's exemption, because it is important also to note that vaccine is not mandatory. It's available for everyone. However, for those who are not able to obtain the vaccination, please make sure also you get medical exemption for whatever reasons you may not be able to get the COVID-19 vaccine. We will make sure to ensure refugees are fully informed about the different options that may be available to you, the different benefits, the different potential risk factors when obtaining vaccine. Vaccine at the end of the day is similar to medicine. There may be side effects. Personally, I did not have severe side effects, sleepiness, maybe a little bit of headache for 1 or 2 days, but after this, it will be fine. There is no guarantee that anyone can give that there will be no side effect, as each person has their own immune system, and how each body respond to the vaccine may be differently. And the best person to give the advice, if you have been consulting a doctor, will be your doctor, or seek information from the proper channels and sources, or indicate to us that these are the information that you may seek to know when we design the awareness session prior to the COVID vaccine exercise. And I'd like to thank you also the different partners, volunteers, expatriates who has been together with UNHCR, separately with partners, or directly with the refugees, supporting the different advocacy work. It's still not done yet. There's still a long way for the advocacy, and we are encouraged by the support through GRS, Ombudsman, SWACA directly. All of this with the same aim as to ensure refugees have COVID-19 vaccination, and to ensure that the government also include everyone in the COVID-19 vaccine. No one is safe until everyone is vaccinated. So and that certainly includes the refugee community. So we hope to have a fruitful discussion with the government that will turn into clear guidance for us going forward on the vaccination. We will definitely inform you all once we have more information, and we look forward to collaborating with you on the further technical details once we know what the scheme is going to be emerging like from the government. Thank you very much, Mas Julio, for the opportunity, and I hand back to you.
Of course. Thanks a lot, Mas Hendrik. It was a good conclusion of this discussion, and we definitely hope to hear more from UNHCR based on your discussion with the government, and how SWACA and every people here who are gathered in this webinar can help you support that, and towards we can achieve the goal of having all refugees vaccinated in Indonesia. So thank you, Mas Hendrik, and everyone. As Mas Hendrik has mentioned, that we have already distributed the evaluation form. So if you are able to fill in, that will be very appreciated, because we can know what kind of information that you need, and then we can devise an information session in the future about that. Thank you, everyone. But before we go, I would like to ask everyone to open up their camera, if you're willing to do that, and then we will have a very quick picture session. So please go ahead. And please also be reminded again that it is going to be live stream on YouTube. So if you do not want your face to be shown, then please do not turn on your camera. It is not obligatory. Now we'll ask my colleague to help me in taking the picture once everyone's ready. It's great to see everyone's here. Thank you for coming, everyone.